1. What is the primary function of the blood pump segment in the dialysis machine? A. Measure dialysate conductivity. B. Remove excess fluid from dialysate. C. Move blood through the extracorporeal circuit. D. Detect air in bloodline. 2. A conductivity alarm goes off during treatment. What should the technician do first? A. Check the patient's blood pressure. B. Bypass the dialysate and notify the nurse. C. Turn off the machine. D. Ignore the alarm if treatment has started. 3. What ensures correct dialysate concentration is maintained during treatment? A. Ultrafiltration monitor. B. Blood pump calibration. C. Conductivity meter. D. TMP gauge. 4. Air is detected in the venous chamber. What is the correct technician response? A. Document and continue treatment. B. Clamp the arterial line. C. Stop the blood pump and check connections. D. Increase blood flow rate. 5. When should the transducer protectors be changed? A. Weekly. B. After each patient treatment. C. Only if visibly soiled. D. Monthly during PM checks. 6. What causes a rising transmembrane pressure? A. Decreasing dialysate flow. B. High arterial pressure. C. Ultrafiltration rate decrease. D. Clotting in the dialyzer. 7. What is the function of the venous pressure monitor? A. Monitor dialysate flow. B. Detect kinks or occlusions in venous bloodline. C. Measure arterial blood return. D. Detect dialysate conductivity. 8. When performing a machine setup, what step ensures air is purged from the lines? A. Initiating ultrafiltration. B. Activating the blood pump. C. Recirculating saline through the dialyzer. D. Priming the circuit. 9. Which reading indicates a possible clotting dialyzer? A. Stable TMP. B. Low venous pressure. C. Increasing TMP and venous pressure. D. Low arterial pressure. 10. What component mixes acid and bicarbonate with water in the dialysis machine? A. Heater. B. Conductivity cell. C. Proportioning pump. D. Air detector. 11. If the machine displays a no-flow alarm, what should the technician check? A. Conductivity meter. B. Blood pump segment. C. Clamp positions and bloodline connections. D. Chair recline angle. 12. What can a post-treatment rinse-back ensure? A. Calibration of TMP. B. Complete dialyzer disinfection. C. Return of blood to patient. D. Removal of residual dialysate. 13. What is the purpose of the heparin pump on the dialysis machine? A. Detect blood leaks. B. Deliver anticoagulant at programmed intervals. C. Control ultrafiltration rate. D. Adjust conductivity. 14. What does a high arterial pressure alarm likely indicate? A. Venous line kink. B. Low dialysate flow. C. Arterial needle infiltration or blockage. D. Clot in dialysate filter. 15. What is verified by the temperature probe before treatment? A. Dialyzer clearance. B. Water pressure. C. Proper dialysate temperature. D. TMP limits. 16. When setting up a machine, why must the saline bag be connected before priming? A. To measure hematocrit. B. Prevent air from entering bloodline. C. Prevent TMP spikes. D. Allow for conductivity check. 17. A blood leak alarm means? A. Needle dislodgement. B. Blood in dialysate compartment. C. Low hematocrit. D. High conductivity. 18. How often should the air detector be tested? A. Before every treatment. B. Once a week. C. Monthly. D. Only when alarm sounds. 19. If venous pressure rises suddenly during treatment, what is the first action? A. Decrease BFR. B. Alert biomedical. C. Check for clots or kinks in venous line. D. Replace arterial needle. 20. A patient reports heat at the access site. What should the technician do? A. Increase dialysate temp. B. Call biomedical. C. Notify nurse and assess for infection. D. Reduce BFR. 21. A failed conductivity test on both sides of the dialysate indicates? A. Dirty transducer protectors. B. Incorrect dialysate mix or water issue. C. Arterial infiltration. D. Venous stenosis. 22. The machine alarm silences repeatedly during priming. What's the best action? A. Disconnect and restart. B. Increase conductivity setting. C. Inspect for error or misconnection. D. Call for more acid. 23. What does a dialysate conductivity below range indicate? A. Overconcentration of acid. B. Too much bicarbonate. C. Too little electrolytes in solution. D. Cold temperature. 24. A machine with no alarm but low TMP likely indicates? A. Line disconnection. B. High BFR. C. Infiltration. D. No ultrafiltration is occurring. 25. The heparin pump delivers heparin at 4 ml HR. What setting adjustment ensures accuracy? A. Air detector off. B. Rate should match order and line primed. C. Saline set open. D. Venous chamber raised. 26. A kinked arterial line will cause what reading? A. High venous pressure. B. Low TMP. C. High arterial pressure. D. Low blood flow. 27. A failed air detector test means the machine must be? A. Run manually. B. Taken out of service. C. Cleaned externally. D. Restarted only. 28. What happens if the dialysate flow stops mid-treatment? A. Arterial pressure drops. B. Venous chamber overflows. C. Dialysis stops and toxins accumulate. D. Ultrafiltration increases. 29. During rinse back, the venous chamber fills with air. What should be done? A. Clamp and restart rinse. B. Abort rinse and reinfuse remaining blood. C. Remove air and continue. D. Open both clamps. 30. What function does the UF controller serve? A. Dilutes dialysate. B. Monitors TMP. C. Balances fluid removal. D. Heats acid. 31. The conductivity value is within range but pH is abnormal. What may be the cause? A. Bloodline issue. B. Contaminated acid. C. Water quality issue. D. Faulty dialysate mixing. 32. How can a ccht confirm air detector is functioning? A. Check visual display. B. Perform alarm test before treatment. C. Watch for foam in dialysate. D. Ask the nurse. 33. A rise in arterial pressure over time typically suggests A. Improved clearance. B. Bloodline crimp. C. Arterial needle issue or clotting. D. Power fluctuation. 34. What causes foaming in the venous chamber? A. Low BFR. B. Air in dialyzer. C. Excess heparin or turbulent flow. D. High dialysate temp. 35. A clot in the venous drip chamber would cause A. Low TMP. B. Decreased venous pressure. C. Increased venous pressure. D. Low arterial pressure. 36. Which part monitors dialysate composition? A. Venous chamber. B. Blood pump. C. Conductivity sensors. D. Heparin pump. 37. The UF setting is 800 ml HR. If fluid removal is too fast, what adjustment is best? A. Increase dialysate temp. B. Lower UF goal. C. Decrease UF rate. D. Increase blood pump speed. 38. What would cause high TMP and low clearance? A. Clotting dialyzer. B. Open transducer. C. Low dialysate flow. D. No heparin. 39. Dialysate temperature shows 40 degrees Celsius. What should you do? A. Start dialysis. B. Document only. C. Adjust heater and verify with thermometer. D. Flush with cool saline. 40. What is the final check before starting dialysis treatment? A. Check dialysate temp and conductivity. B. Review weight. C. Confirm allergies. D. Confirm parking brake. 41. A patient's machine shows TMP rising but pressures are normal. What's likely occurring? A. Air detector failure. B. Clot formation in dialyzer. C. Arterial occlusion. D. Ultrafiltration paused. 42. What should be checked first if the blood pump stops unexpectedly? A. Saline clamp. B. Heparin line. C. Motor and segment connection. D. Acid level. 43. When using a single needle, why might arterial pressure be high? A. Inadequate needle gauge. B. Rapid fluid removal. C. Needle may be malpositioned. D. Acid overly diluted. 44. A backup battery alarm occurs. What is the technician's response? A. Ignore it during treatment. B. Switch to manual mode. C. Notify staff and plan safe termination. D. Turn off power. 45. What component prevents reverse dialysate flow? A. UF controller. B. Heparin line. C. Check valve. D. Air trap. 46. Which alarm should be prioritized immediately? A. Conductivity. B. Air detector. C. Arterial pressure. D. TMP. 47. How often should a calibration of pressure monitors occur? A. Daily. B. Before every treatment. C. Weekly. D. Per manufacturer protocol. 48. What can cause inconsistent conductivity readings? A. Constant flow. B. Stable acid concentration. C. Variable flow or mixing. D. High temperature only. 49. If saline line is clamped during rinse, what may occur? A. No alarm. B. Air enters system. C. Rinse incomplete. D. High arterial pressure. 50. What should you do if TMP reads 0 throughout treatment? A. Adjust BFR. B. Replace machine. C. Check transducer lines and connections. D. Increase UF goal. 51. Why monitor venous pressure during treatment? A. Check needle direction. B. Detect clots or occlusion in return line. C. Monitor dialysate composition. D. Evaluate dialyzer clearance. 52. Which issue does the ultrafiltration control system manage? A. BFR level. B. Venous needle alignment. C. Fluid removal rate. D. Acid safety. 53. A rise in venous pressure with stable arterial pressure may mean? A. Clotting in return line. B. Infiltration. C. Machine calibration issue. D. Water alarm. 54. What's the effect of a blocked dialysate drain line? A. Drop in TMP. B. Dialysate overpressure and alarm. C. Loss of blood flow. D. Heparin overdose. 55. During rinse back, the venous pressure spikes. What should be done first? A. Continue rinse. B. Clamp return line. C. Increase saline flow. D. Stop pump and assess line. 56. The UF rate suddenly drops to 0. First check. A. Battery backup. B. Acid flow. C. UF control setting. D. Heater function. 57. What does a conductivity alarm combined with pH out of range imply? A. Temperature problem. B. Water quality or mixing error. C. Blood contamination. D. Heparin overdose. 58. What causes TMP to rise steadily? A. Rapid fluid loss. B. Decreasing clotting. C. Clotting in the dialyzer. D. Line disconnection. 59. What does a stable TMP with increasing arterial and venous pressure suggest? A. Stable treatment. B. Increasing dialyzer resistance due to clotting. C. Pressure sensors faulty. D. TMP malfunction. 60. What occurs if dialysate temp is below range? A. No effect. B. Alarms and shutdown. C. Vasoconstriction and patient discomfort. D. Ultrafiltration speeds up. 61. What is the best indicator that a dialyzer is functioning properly during treatment? A. Machine alarm silence. B. Stable venous pressure and clear dialysate. C. Patient feels comfortable. D. Constant blood pump noise. 62. Which situation requires an immediate rinse back and discontinuation of dialysis? A. Conductivity deviation of 0.1. B. TMP suddenly spikes and patient complains of chest pain. C. Arterial pressure drops slightly. D. UF goal not reached. 63. What is the purpose of the blood leak detector in a dialysis machine? A. Monitor air bubbles and lines. B. Detect blood entering the dialysate pathway. C. Reduce machine noise. D. Measure venous pressure. 64. If the blood pump is set too high, what complication may occur? A. Hypokalemia. B. Air embolism. C. Hemolysis. D. Hypernatremia. 65. A sudden drop in venous pressure typically indicates which issue? A. Blood clot in dialyzer. B. Venous needle dislodgement or disconnection. C. Increased resistance in bloodlines. D. Patient coughing. 66. What action should be taken if the air detector alarm sounds during treatment? A. Silence the alarm. B. Call the nephrologist. C. Clamp the venous line and stop the blood pump. D. Flush the dialyzer. 67. Which component removes excess fluid from the patient's blood during dialysis? A. Air trap chamber. B. Ultrafiltration pump and transmembrane pressure. C. Dialysate bypass. D. Venous drip chamber. 68. What does an increasing TMP during treatment suggest? A. Decreasing UF rate. B. Membrane clotting or fouling. C. Conductivity issue. D. Reduced blood flow. 69. What condition can result from inadequate machine disinfection? A. Elevated phosphorus. B. Septicemia or pyrogenic reaction. C. Hypercalcemia. D. Hypertension. 70. When should a machine's alarm history be reviewed? A. Weekly during staff meetings. B. After any unexpected treatment outcome. C. Only if the patient complains. D. Before every rinse back. ccht Technical Operations and Machine Functions Test. The ccht Technical Operations and Machine Functions Test evaluates a dialysis technician's knowledge of the setup, operation, and maintenance of dialysis equipment. This section of the exam focuses on the technical aspects of hemodialysis, including water treatment systems, dialyzer function, machine calibration, alarm troubleshooting, and system monitoring. Test takers must demonstrate an understanding of how to identify machine malfunctions, interpret pressure readings, and ensure that all equipment meets safety and performance standards. Mastery of these skills is essential for delivering safe, effective dialysis treatment and for protecting both patient health and equipment integrity in clinical settings. Here are the top 5 beneficial uses of the ccht Technical Operations and Machine Functions Test. 1. Equipment proficiency. It ensures technicians can operate, monitor, and troubleshoot dialysis machines safely and effectively. 2. Treatment accuracy. Mastery supports proper setup and calibration of equipment, helping to deliver precise dialysis treatments. 3. Patient safety. Knowledge of alarm systems, conductivity, and temperature controls prevents machine-related complications and errors. 4. Regulatory compliance. It confirms adherence to standards set by CMS, AMI, and state health agencies for equipment operation. 5. Job qualification. Passing this portion of the exam is essential for certification and employment in dialysis centers and nephrology clinics.